to our distinguished guests and important personalities that was acknowledged a while ago, our distinguished colleagues, public health leaders, fellow legislator, valued partners, magandang umaga po sa lahat. Ngayong araw na to, we gathered here not only to talk about family, adolescents, youth health, but to affirm our responsibility to protect the future of our respective cities. In Lapu-Lapu, our youth are not problems to be solved. They are potential to be nurtured. And when we invest in their health, education, and empowerment, we invest the progress in every family and in every barangay. That's why the city government of Lapu-Lapu has embraced the Challenge Initiative, or the TCI, in partnership with the Zwillig Family Foundation, Commission on Population, and Department of Health. Through this collaboration, we are strengthening our capacity to deliver adolescents and youth-friendly health services, expand access to correct information, improve governance so that our policy are not only well-written, but truly implemented. What TCI unique in its approach? It does not impose. It empowers. It challenges LGUs like ours to step up, innovate, and sustain our own gains. Through TCI's coaching and high-impact practices, we are promoting responsible decision-making among families and young people, preventing early and unintended pregnancy, providing safe spaces where they can seek guidance without fear of judgment. This is not a health agenda. It is a development agenda. So ngayon, I want to share a story about our city, our beloved city of Lapu-Lapu. A story not just a problem we face, but of the strength and resilience we found by working together. Not long ago, Lapu-Lapu City faced a critical challenge that was both silent and serious. Our vibrant city, known for its energy and dynamism, was grappling with a troubling trend: the rising numbers of adolescents murdered from 2020 to 2023. The adolescents' birth rate jumped from 14 to 23 cases per 1,000 adolescents. Family planning data did not accurately reflect the current family planning user, as women 50 years and those who no longer residing in the city were still reflected in the Field Health Service Information System. Hence, there is a sharp drop of the modern contraceptive prevalence rate, or the MCPR, when we remove this group from the database. Lapu-Lapu City has not reached the target from modern contraceptive rate from 2022 up to the present. We knew this meant young people and families were making critical decisions without sufficient information, resources, and support. Not all barangay health personnel were trained on adolescents job aid or family planning competency-based training for long-acting methods. But this was never just about statistics. It was about the well-being of our youth and of our families. Young people face life without adequate parental guidance, vulnerable to peer pressure, while myths and misconceptions on family planning kept even willing families from seeking care. These challenges reveal one core issue: our communities lack trusted, accessible, and judgment-free reproductive health information and services. We knew we couldn't just stand by and watch. It was our responsibility to act. We recognize that to solve this problem, we had to look to the heart of our community. That's why we partner with the Challenge Initiative Philippines and other government and non-governmental organizations to create a comprehensive and a community-centered strategy. We started by reframing the conversation. We shifted our message from just talking about contraceptive to embracing the bigger idea of responsible parenthood. We made it clear that the family planning is not about using contraceptive, but about empowering to achieve their goals through responsible parenthood. At the center of this new approach, our barangay health workers, our community's champion. These dedicated men and women are our most trusted health messengers, living in their neighborhoods, speaking their languages, understanding their unique concerns on the first hand. The barangay health workers are the barangay health educators and promotion officers. They go house to house, debunking myths and connecting families to barangay health center to get the care they need. The barangay health workers are trained to provide confidential and non-judgmental support, ensuring that every young person, women, and family feels respected and cared for. Their commitment has been exceptionally that they've been recognized as a PBI champion or the performance-based incentive champions, a testament that they exceeded expectation when it comes to meeting performance indicators and providing quality service to the community for the entire Region 7. We strengthen our health system by investing in our people, training more providers in underserved barangays, ensuring access to the full range of contraceptive options, and equipping them with the adolescents' health skills rooted in confidentiality and non-judgment. We also invest in our barangay health workers, giving them the support and professional growth that they deserve. The results are beginning to show. Adolescents' birth rate have started to plateau, stigma has lessened, and more young parents now seek prenatal and maternal care without fear. This progress proves that when we empower our frontline workers, embrace data-driven leadership, and commitment dedicated financing, we create a lasting changes. Lapu-Lapu City Journey is a proof that when we put our people's well-being first, we not only improve health outcomes, but we build a future where every young person can make informed choices and every family can thrive. So, in behalf of our beloved, ever dynamic, active mayor, I am honored to represent our beloved city of Lapu-Lapu. Magandang araw po sa lahat.